Good morning and welcome back to White Mountain Today here on White Mountain TV 16. And joining us in the studio, a whole bunch of people we've got in the studio today. We're going to talk about a lot of great things. And John Idoine is here, and also Matt Geary and Chris Geary are here. And we're going to talk about physical therapy at Memorial Hospital and more. But we'll just kind of start that off as the intro piece. John, why don't we start with you and let us know what you're involved with, obviously, at the hospital.
So my name is John Idoine, and I'm an orthopedic surgeon at Memorial. I've been here for beginning my third year now. I'm shoulder and elbow fellowship trained, so most people in the community know me for that. But I also do other surgeries at the hospital, so that's how I kind of got to meet Matt. So yeah.
Well, that's great. And so I didn't mean to just introduce as physical therapy. It's the big picture. But you've expanded the physical therapy at Memorial Hospital, and that's kind of what got us down here today. And so, Matt, what is your new involvement with the hospital?
Yeah, so my new involvement is I'm working for Memorial Hospital's Outpatient Physical Therapy Center. Most folks in the Valley know that as the former One-to-One Fit building, which is part of that Memorial Hospital campus. So I've moved over there. We're expanding our services, more providers, easier access, which is fantastic. And it also allows me to work very closely with the folks, the orthopedic surgeons and the sports medicine docs that we have over there.
Well, that's great.
Yeah.
And then we kind of tied everything together with Chris, who, through the combination of these folks here, is running and walking and jumping and climbing and screaming down the road, basically, on your new knee.
Yes.
So let's talk about that. Let's talk about how that all came together for you. Of course, you probably had your first knee surgery at a very young age, I probably imagine.
I was 15 years old,
yeah.
And I've had 3 knee surgeries on my right knee, and when I had the Red Pocket Challenge, I managed to tear both meniscuses and my ACL on my right knee, and so we met John. And I came to him with a whole bunch of stuff on my plate, and he made miracles happen.
And what we were talking about that before, because John, you were saying that Chrissy's knee is different, that it's not, if I've never had knee surgery, I've never had knee injuries, knock on wood, it would be a different scope, or different, scope, than what Chrissy had to face because of her multiple surgeries.
Yeah, you're exactly right. So first of all, she's an elite athlete. She injured her knee at an early age, and she's had multiple surgeries done. So when I met her, she had come to me already having undergone 2 ACL reconstructions that ultimately went to fail. So that brings its own set of complications to the case. So actually, her knee surgery had to be staged. The first stages was actually to just re-augment the bone so that we actually could reconstruct it safely. So yeah, she had to go through a series of, I think, 3 surgeries over the course of the year, which is always makes the risks higher, the rehab more difficult, and obviously we couldn't be more pleased with how the final result came out. So
absolutely. And you like you say, it's just you're trying to reconstruct something that is not the same as what somebody else might have.
Yeah.
And that's, I mean, I would imagine, Chrissy, that a year ago or when you injured it, you probably thought that maybe that was it.
Oh, definitely. Because looking at the x-ray itself and like seeing what, the pictures of my knee, like there was so many holes. And after talking to John, realizing that like a lot of doctors wanted to put a pin through it where there wasn't any bone, and it would have like collapsed my knee. But since having gone through John, like my knee is 10 times better than it's ever been.
That's amazing.
Yeah, I mean, I've gotten probably 600 miles in on it just running this summer. And I did the half marathon here in the Valley 2 weeks ago, and I wasn't sore at all. I wasn't like, my knee was perfect.
That's awesome. Mm-hmm. Now, part of that, though, is, John, you're talking about the surgery and everything else. Everybody knows that. But I imagine there's a lot of people who think, okay, I'm going to have knee surgery, and then tomorrow I'm going to walk and I'm going to be great. But that doesn't really happen. That's where you need to have good physical therapy.
Exactly, and that's a great segue into what our relationship with Matt is. especially on a knee, complicated knee like that, the rehab is more complicated, and it needs, and people do need to realize that their surgery is 50% of the actual recovery. What they put into physical therapy afterwards is the other half that really is the icing on the cake. So,
and so that's where you come in, and giving people instruction and making it so hopefully they'll do their rehab and get back running again. So what did you do? Because you worked with Chrissy with that.
I did, and Chrissy is a little bit of a different situation, not only because she's my wife, but she's an elite athlete. She's been through this 3 times prior. She'd had an ACL reconstruction on the left knee as well, and this was her 3rd one now on the right knee. Going into surgery, what we didn't mention is she also had meniscus tears on the other leg, on the good leg. So we had a lot of complicating factors, and so with someone like Chrissy, who's a very highly motivated, elite level athlete, who's been through it before, we change things. There's less, in some ways, there's less instruction with the introductory level exercises, and more about how can we modify your activities to get you to the place you need to be, and then also have that very close communication with the surgeon along the way. How are we managing swelling? How's range of motion? The expectations for a surgery, a complicated revision like this, are a little bit different. And so, like I said, there's a lot more communicating back and forth. And ultimately, I couldn't be more pleased. I think that I would say that the success that we had here is really unparalleled. There's nowhere else that we could have gone and had a better result. What we're looking at is a knee that is doing fantastic.
That's unbelievable.
And an athlete who's back to what she wants to do. And along the way, we, like I said, talked to John Idoine a lot, going back and forth about results and progress, and then also actually involved one of the sports medicine docs over there. As we were trying to get her back on snow last year, we did some research and found that we could actually get her on a snowboard a little bit sooner because of the much lower risk of ACL injury and ACL stress on a snowboard, and she was actually able to get on snow within that year, which was a huge goal for her, and was really successful, and our kids loved it.
Yeah, that's awesome. I think one of the other things too, I'm going to kind of throw in a personal note, is that, with physical therapy, I had the surgery. I want to be running. Why am I not running? It's been a week. Why am I not running? And that's where, working with somebody with physical therapy who can kind of understand that and relate to the person. I have actually gone to see Matt for some back issues, and you've explained things in ways that now I understand. I understand why I should be doing this, and it didn't come at you got to do it, otherwise you'll never walk again. You explained everything. I mean, from the very first day I said, wow, this makes sense, and now I can do some exercises, get my back to where it needs to be, and not be living in agony every time I tweak it. So I think that is such an important factor, and I think that I think that it just sounds like everybody working together. That's how people are going to get out, and they're going to be running again. They're going to be walking again. Probably for some people, it's not even running. It's walking, and you say throwing a baseball or whatever it might be, because you use arms, elbows, and shoulders. See how I threw that in there? Well, that's great. So how does somebody, I guess, take the first step there? There might be somebody watching going, you know what? That sounds like me. I know I need to do something about it. So what do? Just get in touch with you, get in touch with the hospital? I know that there's, I'm letting you explain.
Well, I think typically most people would ask their, primary care physician, who might give a referral to our office. Some people actually get referred right to physical therapy from their primary care, so that gets them in contact with Matt. If Matt feels like it's something that, oh gosh, this really needs to see, the surgeon, then he will refer to us. So, I guess really the first step is, probably contacting your primary care physician.
Well, that sounds great. Well, thanks so much for coming down today, and you opened up my eyes to a lot of different things that that I don't know about, and I live in town and everything else. So, great opportunities for everybody who lives right here in the Mount Washington Valley. So
thank you very much.
You don't need to travel far to get the great service that we have right here at Memorial. So.